Hi, Dr. Eric Westman here with another episode of Learn with Dr. Westman. This episode is on how to lose belly fat and keep it off. I've been helping people lose weight, reverse diabetes, and other metabolic problems at Duke University now for over 20 years, starting with our initial research and now clinical care that we give. And it strikes me that the fundamental principle that's missing in the knowledge of people coming in, and even doctors and medical students, is that fat comes from sugar. Okay, you could get fat going to fat, but in our real world, the most common thing that's happening today is extra sugar is turning to fat. So the sugar that you consume is different than the fat that you consume because of the hormonal response that sugar makes. So, you hear a calorie is a calorie. Well, no, the way calories work in our body is very different depending on the hormonal response to the calorie. So if you drink sugar sweetened beverage or juice, you've had extra energy for the day than you burnt off. Especially if you're relying on your diet to do everything for you, you're unable to exercise, or you don't want to exercise, or you can't because of pain, then you're going to be turning that sugar into fat because the sugar stimulates insulin secretion. And insulin is the fattening hormone internally, whether it comes from your pancreas or externally if you inject it as a type 2 person with type 2 diabetes. So sugar turns to fat, and the place where the most damage can happen is if sugar is turning to fat in your belly. The abdominal fat is the fat that actually is associated with all of the metabolic problems of being overweight or obese. You might not know it, but obesity is up there on the risk factors for heart disease and stroke, for atherosclerosis, which is the hardening or narrowing of the arteries throughout the body. So it's the belly fat or abdominal obesity. These are all the same terms, or visceral fat is another term that is applied to the same situation of accumulating belly fat. This is associated with the serious metabolic problems that go along with overweight and obesity, and many times with type 2 diabetes, pre-diabetes as well. But so how do you lose that belly fat? Well, there are many different ways. You can use one of many different diets or medication or meal replacement programs or even weight loss surgery. But the one diet that really targets the belly fat is the low carb or keto diet. And the reason for that is you're keeping the sugars and starches so low that you maximize your fat burning from your body. So, and you don't add in oils and fats and butter and medium chain triglyceride. Don't do any of those kind of internet keto things. You want the fat that your body burns to come from your belly fat. And you may not know it, but your body can actually generate ketones by itself from the fat that comes from your body when you're burning your belly fat and other fat. So you don't have to drink ketones, you don't have to take ketone pills or have oils or even coconut oil or other things are being touted as ways to get into ketosis and to fat burn. But I want to maximize your belly fat burning by having you burn your belly fat, not the fat and oils that you're drinking. So to maximize the belly fat burning, you want to keep the carbs really low. And what happens on a properly formulated keto diet, one that I've been using for over 20 years now, is that the hunger goes away after a day or two. The cravings go away for the foods that you used to consume. So it happens really pretty fast. And then you start burning your body fat. Typically, I'll see people lose 1 to 2 pounds per week on this kind of, eat as much as you like of the meat, poultry, fish, and shellfish, and eggs. You keep the carbs under 20 to 30. I prefer 20 total grams. Other programs have used 30 total grams for the day. That's not per meal, but 20 grams of carbs for the day means that you're not going to be able to burn much sugar your body looks around and says, well, there's no sugar, where am I going to find energy? And it looks around and says, wait a sec, I have this belly fat. So you start burning your belly fat automatically just by keeping the carbs really low. So you can actually become a fat burning machine, not by adding fats and oils, but by keeping the carbs super low. So drop the sugars. Starches get digested to sugar. So if you want to maximize your fat burning, your belly fat burning, you want to keep the carbs really as low as possible. And I have the 20-30 gram total carbs for the day as a program that we've used now for over 20 years in research and clinical care. In fact, the program that I use was built upon programs that going back to the 1860s. It used to be called the Banting diet, and then doctors in the 1900s like Dr. Atkins, Dr. Eads, Dr. Bernstein, Dr. Rosedale all kind of used the same super low carb diet without adding oils or ketones, without all of the kind of new internet products that you'll see. It's just keeping the carbs low, eating real food just as much as possible. So to maximize your fat burning and your belly fat burning, keto, low carb diet is actually superior in several head-to-head trials to a low calorie, low fat diet. And we think it's because the insulin is brought down just a little bit lower, and insulin is the fattening hormone. So if you want to maximize your belly fat burning, choose a keto or low carb diet over others, although other diets can work. Medications, meal replacements, and even surgery can work, but there's a lot of hassle with all that. I think using a real food-based program certainly is a place to start. As I look at all of the different ways we have and worked with doctors all around the country, there are a lot of different kinds of programs, but it seems to me the simplest and most like expeditious, elegant way is to just use food to generate the fat burning and ketones automatically, and you do that by keeping the sugars and starches really, really low. And targeting the belly fat is really important because this is where a lot of the atherosclerosis, the chemicals that come out that cause inflammation come from the belly fat, also known as visceral fat, abdominal obesity. It's all part of the metabolic syndrome in the bigger picture, which includes the triglyceride and HDL in the blood glucose and blood pressure, and that increased belly fat. So I hope that's helpful. Remember, it's sugar that turns to fat, and the detail is that it happens in the liver. So yes, fatty liver is from the sugar and starch in the food, not from fat in the food. I've seen doctors trip up on that, so they may not give you the best advice if they're not specifically trained in this too. I hope that's helpful, and be sure to click on the subscribe and ring the notification bell, and look down below for my latest free handout on how to get started on keto in the right way. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.